Foundation Module 3 UHS Modular Integrated Undergraduate Curriculum Physiology Dr. Sheen CEO and Founder Sheikh Zayed Medical College Physiology Department. Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 Edition Chapter Number 5 Lecture Number 10. Explain the effects of hyperkalemia and hypokalemia on the resting membrane potential, RMP. Name the membrane stabilizers. Hyperkalemia and hypokalemia both affect the RMP conditions where the extracellular concentration of potassium ions is abnormally or low, respectively. Both conditions significantly affect the resting membrane potential of cells, like neurons and muscle cells, due to their impact on potassium ion, K+, gradients across the cell membrane. For hyperkalemia. Hyperkalemia is a condition where there is an elevated level of potassium in the blood. Effects on RMP. Potassium ions are important in maintaining the RMP. Normally, the inside of the cell has a high concentration of potassium compared to the outside. The RMP is primarily determined by the difference in potassium ion concentration across the cell membrane. In hyperkalemia, the extracellular concentration of potassium increases. This reduces the gradient between the inside and outside of the cell. The Nernst equation, which calculates the equilibrium potential for potassium, indicates that an increase in extracellular potassium concentration makes the membrane potential less negative, depolarization. Depolarization can make cells more excitable initially because the membrane potential is closer to the threshold for action potential generation. However, prolonged depolarization can inactivate sodium channels, making it difficult for action potentials to occur, potentially leading to muscle weakness or cardiac arrhythmias. Hypokalemia. It is a condition where there is a decreased level of potassium in the blood. Effects on RMP. In hypokalemia, the extracellular concentration of potassium decreases, increasing the gradient between the inside and outside the cell. The Nernst equation indicates that a decrease in extracellular potassium concentration makes the membrane potential more negative, hyperpolarization. Hyperpolarization makes it more difficult for the cell to reach the threshold potential required to produce an action potential. This can lead to muscle weakness, cramps, paralysis, and in severe cases, cardiac arrhythmias because the cells are less excitable. In summary, hyperkalemia and hypokalemia have significant effects on the RMP, leading to changes in cell excitability that can have profound physiological consequences. Name the membrane stabilizers. Membrane stabilizers are agents used to stabilize the resting membrane potential and prevent excessive depolarization or hyperpolarization, especially in treating conditions like hyperkalemia and hypokalemia. Name of some key membrane stabilizers. 1 = calcium gluconate or calcium chloride for hyperkalemia. Stabilizes the cardiac cell membrane by increasing the threshold potential, making cells less excitable. It is given intravenously in acute hyperkalemia to protect the heart from arrhythmias. 2 = sodium bicarbonate. Alkalinizes the blood, promoting the shift of potassium from the extracellular space back into cells. It is used in cases of hyperkalemia with metabolic acidosis. 3 = insulin with glucose. Insulin facilitates the uptake of glucose into cells, which in turn promotes the intracellular movement of potassium. Given intravenously along with glucose to prevent hypoglycemia, it helps lower extracellular potassium levels. It is used for hyperkalemia, particularly in patients with respiratory issues. 4 = beta-I2 agonists. Albuterol stimulate beta-2 adrenergic receptors, leading to the activation of Na-K ATPase, which drives potassium into cells. For hypokalemia. 1 = potassium supplements. Directly increase extracellular potassium levels, helping to restore normal membrane potential. Oral or intravenous potassium chloride is as commonly administered to correct hypokalemia. 2 = potassium-sparing diuretics, e.g., spironolactone, amiloride. Prevents potassium loss in the kidneys by inhibiting the action of aldosterone or blocking sodium channels in the distal nephron. Used to maintain or restore potassium levels, especially in patients on other diuretics that cause potassium loss. 3 = magnesium supplements. Magnesium is a cofactor for the sodium-potassium ATPase pump and helps stabilize membrane potential. It is used along with potassium supplements in hypokalemia. Summary. Membrane stabilizers are critical in managing electrolyte imbalances that affect the RMP. Agents like calcium gluconate, sodium bicarbonate, insulin with glucose, and beta-2 agonists are used to stabilize the membrane and shift potassium into cells. Membrane stabilizers are critical in managing hyperkalemia and hypokalemia. Their careful and timely use can prevent severe complications, especially in cardiac and neuromuscular functions.